Kia ora, everyone. My name is Andrea. As you know, or some of you might know by now, our regulars to the webinar will know. And I'm very happy to be back with you today and have a wonderful guest here with me, Paula Tesoriero, and we'll introduce her in a minute. As you know, these webinar series are part of a discussion series that we have started during the COVID period in April, and it will continue until September. And we have asked a number of different people to contribute chapters for our progressive thinking booklet on the future of public and community services. So some of you will know that we have done these booklets before on text as well as on housing and the future of work. So watch this space. Sometime at the end of the year that book will be published. But in the meantime, as you know, you can find all the chapters and speaking notes from people on our website and also on Facebook. And do share, of course, with your networks and your friends and colleagues. So just a quick run through the webinar and how we are going to do it. Very simple. We'll do a short introductory session, and then our guest will present, you know, the main issues she wants to talk about. We'll have a bit of a discussion, and then, of course, quite a bit of time for your questions that you can please post in the question and answer section of Zoom, not the chat function, please. It would be great if you could use question and answer function. And also, please try to keep your questions reasonably short and succinct. That would help me in kind of building them into the conversation. I also have an apology to make. We have tried to get a transcription service, and but it has failed us, unfortunately, and we won't have any captioning. We will try to improve this next time. My sincere apologies for that, but it unfortunately didn't work out. I think that might be all. Yes, I think we can just move over to welcoming Paula. I'm so excited to have you here. Paula Tesoriero, the Disability Rights Commissioner since 3 years, and Paula has been just confirmed in her role for another 5 years. So congratulations for that. That is great news. And as always, we have had a bit of a chat before the webinar, and you told me that you're disabled, that you're a leader and a mum. So would you like to explain a little bit what you mean by that, and yeah, give us a bit of an insight into your life as the Disability Rights Commissioner?
Sure, thanks Andrea. Kia ora koutou, ko Paula Tesoriero tōku ingoa. As Andrea said, I'm the Disability Rights Commissioner, and I guess that's the leader component of that part of the introduction. And you know, I don't lead on my own. I think that there is so much to be done in the world of disability rights. I see my role as one of leading in some areas and working in collaboration on a range of other areas, and I'm sure we'll talk about those throughout our session. Being a mum, that's my most important role. So I am mum to 8-year-old Samuel, and I am a stepmum to 2 teenagers, 14-year-old Nicholas and 16-year-old Elizabeth. And so my husband Peter and I and the 3 kids have like other families, busy, full-on lives, and experience, like other New Zealanders, some of the benefits of being able to spend a little bit more time with family during that period. And being disabled is core to my identity. So that's the other word that you referred to, Andrea. So it is core to every aspect of me. And I think it's interesting, often people say to disabled people, and I've had this all my life, you know, gosh, you've achieved a lot, or gosh, you know, despite your disability. And I try and reverse that and say, well, actually it's all because I'm disabled that my life has taken the path that it has taken. And you know, there's no despite this, it's actually because of it. And I'm very proud of that identity. So that's a little bit of me, just a little bit in a nutshell.
No, thank you so much. Thanks for sharing that with us. You wrote about building inclusive societies and building specifically an inclusive New Zealand, and how community public services can contribute to that. So I guess we should go straight into what you have to say, what you have to share with our listeners. And yeah, then I'm surely going to have quite a number of questions for you. So please, the floor is yours.
Fantastic, thank you. I'm really pleased to have this opportunity. I've done a few webinars now over the last few months, as we all have, and I'm starting to quite enjoy them actually. But I do really encourage you to send some questions through. That's, you know, the benefit of one of these types of exchanges. And I think congratulations to the PSA for having these series and for getting people to think about a wide range of issues. So I have been talking a lot, as you referred to, Andrea, about rebuilding a more inclusive Aotearoa New Zealand. And so I'm going to make some comments about that. And then, as Andrea said, there'll be a range of questions and discussion. So worldwide, the response by governments to COVID-19 has emphasised that we're all in this together. And it got me thinking about whether or not we can stay in this together. If we can stay in it together, I think we have a fighting chance of achieving the catch cry of the United Nations Sustainable Development Goals of leaving no one behind. In New Zealand, we like to think we live in an inclusive and fair society, but that's not the reality for everybody. Our society was built and designed for a portion of our population. So in rebuilding, resetting our country, can we achieve a more inclusive society? Will the 24% of New Zealand's population who are disabled and whom most of you serve, will they be front and centre or left behind? And what is the role of the public and community sectors as employers, policymakers, service providers in creating a post-COVID-19 inclusive New Zealand? Now in level 1, and moving very quickly into our rebuilding phase, we're entering a new business as usual, which offers, I think, huge opportunities for creating an inclusive New Zealand. As the Disability Rights Commissioner, my role is to protect and promote the rights of disabled New Zealanders. And I use that term deliberately because that is the preference of disabled people rather than people with disabilities. And that's because it reflects what we call the social model of disability, which says, I'm not impaired, in my case, because I'm an amputee. Rather, what is disabling is how society builds itself, creates itself, and the policies and services that are designed. Those are the things that does us all to reflect on the fact we have a collective responsibility to reduce those barriers. It became apparent very quickly in New Zealand during COVID that existing gaps in services and policy approaches were exacerbated for disabled people. I want to touch on some of the challenges and also some of the things that we learned and that worked well. Through my role, I saw firsthand agencies grapple with how to ensure marginalised groups were responded to. There was a stream of work that was set up across government that reflected some partnership with NGOs and some community groups and office holders like my own. That was the right thing to do. But it highlighted existing gaps that needed urgent sealing. Some of the band-aids worked, and some gaps were just too big to immediately resolve. This stream of work showed a real, genuine commitment from government to work with community. For this to work in a sustainable way, we need to integrate that across all levels of government. There were many issues common to both disabled people and older New Zealanders during the COVID response. Some of the most significant gaps were due to agencies and essential services just not understanding the reality of disabled people's lives. You will have heard about the many issues around personal protective equipment. There were real problems in getting PPE to home and community support workers and providing community-specific guidelines. The Auditor General's report, which I contributed to, highlighted the many issues and made recommendations that hopefully will reduce the risk of this happening again. I spoke last week with some disabled young people of their experiences during COVID. And one of the points a young woman with arthritis and another with autism made was the difficulty they had with invisible disability and the lack of service and support they had. So it meant for them standing in long queues in pain, not allowed to shop with their support person, or facing real judgment and not understanding what the new rules are. For many of us, those rules were fine. We got it, right? We tuned up to the supermarket, there was a queue. You stood 2 meters apart, you did your thing. But that's not the way our lives normally work. So for some people with things like autism, it was an incredible challenge where the social norms and rules just suddenly overnight changed. And we weren't always as kind as we were encouraged to be when we encountered people with those types of impairments during lockdown. One of the young women that I spoke to who had autism was asked in a shopping queue if she had been living under a rock when she asked what the lineup was all about. Be kind, we are told. For some, it appeared that that was a big ask. I think a social marketing campaign that promotes inclusivity and positive views of disability and disabled people in New Zealand is long overdue, and I'm hoping to work in partnership with a range of others to bring such a campaign to New Zealand. The digital divide created real challenges for disabled people and older New Zealanders who simply could not access information online. It was a real issue for some disabled children learning at home without the normal tactile and hard copy resources available. Access to information is critical, essential for participation, and we didn't do as well as we could during COVID. At a time when information changed almost daily and information was not quickly available in accessible formats, the frustration in the community was palpable. While there was frustration, there was also willingness by government to work in partnership to improve this situation. One of the positive illustrations of communications was the use of New Zealand Sign Language in the daily briefings from the Director General of Health and the Prime Minister. Deaf Aotearoa, one of the disabled people's organisations, reports that more opportunities for interpreters have been opening up, and sign language classes have become hugely popular, with some selling out across the country. So I guess that visibility of people seeing sign language has resulted in a a positive change. But accessibility in all formats is important for public and community sectors to keep in mind. If during COVID, agencies were all in a really good habit of creating accessible formats, if the COVID website had been accessible, if the processes had been put in place to ensure that all of that information would be created in accessible formats in as close to real time as possible, if we did that during peace times, then during a COVID emergency where information is critical, we would have done a lot better. Accessibility to housing, transport, information and communications. Allow disabled people to work, have a home, participate in our communities, get an education, use public transport and be informed. These human rights might be restricted during emergencies, but those limitations must be proportionate and necessary. I think one of the biggest learnings from COVID will be seen in the absence of disability data. It's an old truism that if you are not counted, you don't count. Like many other countries, disaggregated data about disability is limited. We had a situation during COVID where actually we really didn't know the true extent of the impact on disabled New Zealanders. We didn't know who was accessing services, who wasn't. When outreach services were tried to be set up, actually it was too hard because agency data systems didn't talk to each other. Disabled people also watched with sadness and at times horror at what was happening around the world to disabled people. There were stories of not for resuscitation orders given by hospitals. There were allegations of eugenics at play as discussions took place about who would receive life-saving treatment. Thankfully, because of our excellent public health response, we didn't have to confront those questions. But we may in future. And when disabled people face a lifetime of poor attitudes and barriers in which our lives can sometimes be seen as not worth living, then it isn't surprising that many were scared and felt powerless, that the state might be in a position to be able to judge who would live and who wouldn't. Disabled people started from behind, so it shouldn't surprise us that during COVID, we were going to be behind. The focus in my mind now must be on equity and ensuring we get to a place where we can start rebuilding from a more equitable position. It pained me to hear that many members of the disability community enjoyed level 4 lockdown because they didn't have to face the daily grind of the barriers ordinarily experienced once they leave their front gate. I believe New Zealand needs to really grasp that sentiment that people enjoyed being at home because the rest of the world is so inaccessible. We really need to grasp that and turn it around. But some good things have emerged and we have to hold on to them. One of the positive things was the introduction by the Ministry of Health of much more flexibility around how funding arrangements worked. This move is to be applauded and I hope can continue. The pandemic also showed us how we can work differently. Flexible employment arrangements, greater reliance on technology, all have the potential to create a real circuit breaker for some of the dreadful employment stats we have in New Zealand for disabled people. During the COVID response, New Zealanders had real insight into the disabling world that many people with impairments or chronic health conditions have on a daily basis. About 30% of public sector respondents in a 2019 survey on diversity reported disability as an important issue, compared to 19% for those in the private sector. Both those numbers are extraordinarily low. And I encourage employers to understand the benefits of having disabled people in the workforce. Disabled people already faced poor employment outcomes pre-COVID, twice the unemployment rate, in fact, of non-disabled people. So in this reset and rebuild, we have to think about how we bring disabled people as part of that economic recovery process. One of the greatest barriers for disabled people seeking work is employers not being flexible around where people work and the hours of work. I keep hearing calls for staff to go back to the big cities to keep inner cities running. I get that, but surely there's a middle ground. We've all said we would change after lockdown. We would value family time and our well-being much more. And we all recognise that working from home might be a way to achieve that. So at the very least, I would call on public sector leaders. I would urge you to see the benefit to your workforce by allowing that flexibility and creating greater opportunities for disabled people. Because at the end of the day, 24% of the population is whom you serve. And if your agencies don't have disabled people employed in them, then how can you know for sure that you are providing the best services, developing the best policy that you can? In late 2018, Cabinet signed off a major piece of work for public sector agencies to thoroughly explore with disabled people how they can achieve full accessibility for disabled people for all New Zealanders. Disabled people should be closely consulted and actively involved in matters such as this that affect them and their participation in the community. If you are asked as a public service agency to be thinking about that accessibility legislation, then really try and think about it through the lens of creating a more equitable basis for disabled New Zealanders. We have a long way to go in New Zealand. Yesterday evening, I, along with the Chief Ombudsman and the 7 disabled people's organisations, launched the independent monitoring report called Making Disability Rights Real. And it's our assessment of where we're at in New Zealand against compliance with the UN Convention on the Rights of Persons with Disabilities that we have signed up to. Fair to say, we're not doing as well as we ought to be across a large number of areas. And you play such a pivotal role in helping to turn this around. Whether we can create a more inclusive world as we rebuild depends on our collective advocacy and calls to action to address the equity gaps for disabled people that have existed for decades and were exacerbated during the COVID response. Let's see if, as New Zealanders, as communities and public services, we can stay in this together, learn from the things that could have been done better, amplify the things that were done well, and really ensure that no one is left behind. Thank you for all the work that you do across government to help ensure that that happens. We have a big challenge ahead of us, and I certainly look forward to working with agencies, as I do, to continue working together to improve the outcomes of the lives of disabled New Zealanders. Ngā mihi nui. Back to you, Andrea.
Wow. Thank you so much, Paula. I mean, there were so many thoughts in your remarks that I would like to touch on all of them, but obviously we won't have the time for it in this webinar, maybe at another stage. But I was wondering, you talked about the severe equity gaps, and we are all very much aware of that for disabled people in particular. And I was just wondering how, if an expansion of public services, public and community services, free services, would actually make a difference to disabled people's lives. Do you think that would be a good first step?
Yeah, I mean, poverty is a real issue for disabled people. And, you know, we have I think, an unacceptable number of children disabled children who live in poverty. And that's because we have less access to paid employment, lower incomes overall, and higher costs of living. And so that creates, immediately some of those gaps. Look, I think that, those types of universal approaches that you're touching on are a good thing to explore. I think it's their accessibility that makes the difference to whether or not disabled people can enjoy those things. I think one of the things that, I touched briefly on was during the COVID response, we did see government agencies creating more flexibility, working faster, and, reducing some of those silos that can exist, and, a lot more flexibility with how disabled people could use their funding, and putting a little bit more control back in the hands of disabled people. So I think some of those things are really worth, exploring how they might continue, and, those expansion of those services, really making sure that they are accessible. I've been encouraging agencies to think about every opportunity you have at the moment. The shovel-ready projects are a great one. Rather than just leap to, do what we've always done, which is restore something to how it was, or not future-proof things. This is a golden opportunity to future-proof buildings and cities and infrastructure that, the government's investing in to help rebuild New Zealand. Let's make it accessible. Let's create things with universal design in mind so that the greatest number of New Zealanders can enjoy them. We lost that opportunity in rebuilding Christchurch. We cannot lose it through this.
And exactly, the importance here is to include the voices of disabled people into those designs and the development of plans already, rather than, coming in at a later stage, I would imagine.
Absolutely.
We already have quite a few questions, and I would like to take up some questions around the importance of flexible working. You touched on that as well in your little presentation, and there was one question about how we actually can keep that momentum and really make sure that employers are going to be on board with continuing flexible working. And another one related to that, which really made me think as well, is about how do we decrease the digital divide here in New Zealand to actually improve inclusion and create greater equity among New Zealanders. I think they are interlinked to a certain degree. So I would be very interested in your thoughts here.
Yeah, I think one of the largest complaint areas that comes to the Human Rights Commission relates to disability. In fact, almost half the complaints. And of those, the two biggest areas of complaints that come to us relate to education and employment. And in the employment area, it's the things around lack of flexibility, or what we actually term lack of reasonable accommodations. So has the employer made reasonable accommodation for the disabled individual to be able to be in the workplace and hold down the relevant job. And so I found it, on the one hand, positive, but also excruciatingly frustrating that suddenly during lockdown we could all work from home, and flexibility was fine, and the hours in which people worked and the location and working from home, we managed. And in many cases, people have reported that in fact, there were huge benefits to productivity and teams engaging more. And you will know all about those things. And so I think it is really important that we do keep reminding leaders of those benefits. And also, many agencies and leaders have really understood those gaps in equity that were seen during COVID. And one way of actually responding to some of that around in the disability area is to really take a hard look at employment for disabled people. The public service could be, or should be, absolutely role modelling far greater employment of disabled people. And if one of the key reasons that agencies can't or won't is because of those issues around some people wanting or needing to work from home or flexible hours, then we've shown we can do it as a country. And so I think it is really important for all of us to be reminding leaders about that. In terms of the digital divide, part of that is and this was a case for older New Zealanders as well. There is a reality that for many disabled people, it won't matter how good access sort of becomes in terms of connectivity and accessible formats and things. Actually, some people just need hard copy resources. They need tactile information, and that's the way it is. But also technology, as we know, opens up huge opportunities for disabled people and other people. And I think we've got to keep exploring those. So, the digital divide, I think, was one of those quite big issues, not just for older people and disabled people, but people in low socioeconomic areas. So lots of work to be done there.
Yeah, thank you. We also have, and I think this is a really central issue in systematically excluding disabled people, accessibility, right? You touched on that quite a few times, and we have a few questions relating to that as well. And there are certain things that we can ask decision makers to build into, their plans, and for example, building houses. Just a new, I think, $3 billion have been made available today that goes into housing projects, transport, community building, things like that. But what can actually, the ordinary person, what can the ordinary person do to actually contribute to better accessibility for disabled people? So basically, what can we all do also in our respective workplaces to help ensure accessibility is a given rather than, a luxury?
Those are a great set of questions. I think, first of all, it is about understanding the obligations that we have as a country and that your own individual organisation has. And there wouldn't be a government agency that doesn't have a responsibility towards disabled New Zealanders. And so really just trying to understand, you don't need to be a pro on all the international frameworks and laws and be a guru on human rights, but you do need to people do need to understand that we've made a set of commitments, and that we all are responsible for meeting those. Most government agencies, in fact, most 38 out of the 39, I won't tell you who the remaining one is, have signed the Accessibility Charter. And that's a charter which sets out a program of work over 5 years, mostly relating to information. So I would encourage you to have a look at that charter, what it means for your agency and your responsibilities. I think the other thing is to challenge ableism. And, we talk a lot in New Zealand, as we should, about racism and other isms, and we have to talk about those things because they're harmful and we need to do better. But one of the isms that we don't hear about is ableism. And I suggest many people don't even know really what it means because it's not a word that we use. But
do you mind explaining it for our audience?
Yeah, ableism is really about people who are non-disabled, putting those perspectives first, whether intentionally or not, but it is prioritizing non-disabled people over disabled people. And so making sure that in your workplace, well, one, that your recruitment strategies and employment practices are supporting recruiting disabled people, and then giving disabled staff a platform for their voice to be heard and, you know, a seat at the table. And I think in your work, you know, make it a habit to question whether disabled people are visible in your work. You know, there's that heading in the cabinet papers that asks for a disability perspective. I don't know how many cabinet papers I have read and it says there are no implications for disabled people. Oh, what? Of course there is. There has to be. Every single cabinet paper, there must be an implication for disabled people, positively or otherwise. So explore it. Really think about the impacts. Have you actually thought about it? The cynic in me says that sometimes people say there are no implications because we haven't turned our minds to it. But in actual fact, you know, my big plea is to really turn your mind to it as policies being developed. You know, are you creating space for disabled people to give you feedback on policies, on service design and delivery? Do you involve disabled people in the review of those things? Because until we start to do those things, we are never going to change those big systemic issues that need to be resolved for disabled people.
Yeah, thank you. I'm quite interested about the data aspects as well that you touched on. We both have a Stats New Zealand background, I believe, and you are very knowledgeable in that area. What kind of data do you think is missing, and what do we need to, because we can't, I guess, capture it all in one go, or maybe we can, but how would you go about better capturing data about disabled people and their lives?
This is, you know, my goodness, we could have a whole webinar on this.
Yes.
And maybe we should, but I think that there are a number of things, Andrea. One, how many agencies are doing research on issues around disability at the moment? You know, that's a question to ask. So it's about data, but it's also about research and evidence. You know, where's the research funding going? Are you appropriately using it to make sure that deep dives into disability issues and things are occurring? I think there's an actual technical system issue around agency data systems not talking to each other. That's existed for I don't know how many years, and it is costly, and you know, it's often the thing that people don't prioritize because it is costly and takes some time. But during COVID, you know, we saw MSD and Ministry of Health data sets not being able to be linked and talk to each other. And in my mind, at a time like that, where we could have got some really good intel, it was very disappointing that the systems couldn't talk to each other. Then I think there's a need to ensure that government agencies are including, at the very least, what's called the Washington short set of questions, which are 6 questions that ask information about functionality and sensory issues and learning disabilities and things. And we've been working really hard, Office of Disability Issues, ourselves and Stats NZ, to try and encourage agencies to include that, because those questions are designed for inclusion in general surveys. So I would encourage agencies to be thinking about that. You know, there were 9 of the 10 government agency surveys that went out during COVID asked identifying information about population groups. You know what? 9 of them missed asking about disability. Golden opportunity to learn about the impacts on disabled people of COVID, and the opportunity was lost. So that forces us into a situation where we rely on quite old data, 2013 data, which is the last time the New Zealand Disability Survey ran. And then because of the issues with the last census, we weren't able to get information from the 6 Washington short set questions that were included in the census for the first time last year. So we're in a position where we don't have good data. There's a number of gaps, but not just in data, it is in the research and evidence base that we have. And so we end up relying often on global data, which is useful and it's a bit of a proxy and it gives us a little bit of a guide, but we can do so much better.
Absolutely, absolutely. I think we are actually coming to the end of our webinar, but I have 2 more questions that I really would like to ask you. One is, they are both from our audience, and one is around the possibilities that people have to contribute to your work. Can they do anything to support you and I guess the Human Rights Commission in general in doing the work that you're doing?
Absolutely. And I think there's huge opportunities to partner in a number of areas. I think here's a challenge before the end of today, because there's still at least 4 hours. By the end of today, just talk about disability in your workplace. Ask some questions. I think there's I think if I'll probably after this webinar think of a much better answer to this, but right now what I would suggest is talking about disability in your workplace. Ask your human resources team, about recruitment practices. Think about, asking some challenging questions about the inclusion or not of disabled people in your workforce. Think about the mechanisms around writing cabinet papers, designing services, etc. How you're considering the needs of disabled people, and are you including disabled people in some of that decision making? So I think there's a sort of own agency contribution you can make, and then there are contributions that could easily be made in collaboration with some of the work that we do. And I think maybe, I don't know, Andrea, maybe there's a mechanism people could touch base with you if they are interested in that.
Absolutely. We also have, I probably want to mention that, and you have talked to our Deaf and Disabled Network at the PSA. So that is a great way of engaging and making the disabled people's voices heard and influence actually policy making and decision making around that. The last question, and maybe a reasonably quick answer, although I know this is also worth another webinar. We have a mum asking a question about her child. And the question is, how can she ensure that care and protection into the future is guaranteed for her child? And I'm sure that is a question that people who are directly affected by disabilities or indirectly affected are very interested to hear if there's, that one single aspect that you would recommend people are doing in order to feel safe and secure into the future for themselves and their families and loved ones.
I don't know if I can give a quick answer to that. There's a lot in that. I think one of the things that parents often talk to me about is that sense of when they're no longer there, what happens to their child, particularly if the child has very high complex needs, less of an issue for some other types of impairments. And parents can spend decades, fighting, and it is a bit of a system of fighting at the moment for parents, right from sort of early education right through. And I guess that's something that, if we can change all of those sort of policy areas we've touched on, then it would make the lives of parents, I'm sure, much easier. Look, I think there's big work going on around, you know, the health and disability system review offers a place to be thinking about some of those issues. I think that there's big work that has come out of, and still going on actually inside the Ministry of Health, around funded family care and how families and carers are supported, are funded, the employment relationships and all of those things that, you know, I think are important to be aware of and contribute to, so that those policies are strong. But I think, you know, at the moment, I mean, how can we guarantee that disabled people will be protected and cared for in the future? I think when we can guarantee that, then there is no need for my role anymore, and that would be a good thing.
Wow, thank you. Thank you very much. That's fantastic. Thank you. We still have a few unanswered questions. I'm sure you would be happy to respond to them later, like other contributors have. So we will make them available to our participants. Thank you. And yeah, I think we need to unfortunately close our session here. It was an absolute pleasure to talk to you, Paula, as always, and you're most welcome to participate in any of our PSA activities around deaf and disabled people, but also policies and other work matters. We have another webinar coming up on the 8th of July, which is actually next week. Some of you might be surprised, because we will have a webinar from now on until September each and every week. So this is the good news. And next week we'll talk to Jeff Bertram, who is going to talk about the possibility of a Ministry of Works and the importance also of physical infrastructure. So do join us again next week. And if you like this webinar, please tell people about it. Share it on Facebook. You can see the webinars on Facebook and also on our website, as well as Paula's speaking notes. And the questions, the remaining unanswered questions, will be made available as well. So thank you so much, Paula. This was, yeah, an amazing webinar. And I will finish by saying thank you and stay well.
Thanks, everyone. Ngā mihi nui. Bye-bye.
Bye.